How would someone know if they were exposed to polio? Although this sounds like it would be an easy question to answer, it can be quite difficult to work out if someone was exposed to polio. There are social factors we have to consider. Those people who got paralysis from polio probably know they had polio. Many children exposed to polio in the epidemics were too young to remember their experience with polio. Most of them were less than 5 years old at the time. They would only know if their family told them about it, or talked about it, if there were photos, or if a sibling had polio paralysis. Some of those with paralysis think their weakness is from something else. They may have been told by their parents that they had some other health condition. This was what some parents did to try to protect their family from the social stigma of polio during the epidemic's era. Some people only found out about their polio exposure decades later. Polio was a taboo subject in some families during the epidemics, and so the topic was never discussed at home. Relatives of the person may have later explained to them about the polio exposure if the person asked questions about their childhood and their health. Amongst those who know they had polio, there are some who don't want to tell others about it, or who don't know that there may be polio health changes in their future health. Immigrants to Australia who had polio in their home country can be fearful of or reluctant to declare a history of polio. There are also record-keeping factors to consider. In Australia, the hospital records for children from the polio epidemics have long been destroyed. One place that may confirm someone getting polio is in the old disease notification books from a region, or in a detailed local newspaper report from the time. These documents can be hard to get access to. We do know where some of the polio cases occurred and in what year. Polio Australia created a Google map layer which shows where many polio cases occurred during the epidemics. It does not show all cases, only cases of those who shared their polio location and year on the Australian Polio Registry. You can use this map to zoom in to look at different towns and suburbs and cities. The pins are coloured by decade, and you can show and hide the decades on the map details panel. This is one way to work out if someone was living in an area where a polio epidemic broke out many years ago. Who can help? People who think they were exposed to polio and who are having some of the 6 post-polio symptoms can ask their doctor about the symptoms. They may be diagnosed with late effects of polio, or may be referred to a neurologist to take a closer look at the symptoms. Because a few of the main symptoms are quite common, they can be mistaken as aging, or for other conditions such as chronic fatigue syndrome or fibromyalgia. As you can see, working out if someone was exposed to polio, or was sick and admitted to a hospital during an epidemic, is not as easy as you might think. What can you do with this information? If you work in healthcare and are suspicious that a client may have been exposed to polio in the Australian polio epidemics, you can ask the client where they lived as a child and where they went to primary school. Then look at the map to see if they match a location and year. If there is a match or continued suspicion, you should inform the client's doctor. If you think your older relatives or immigrant friends might have been exposed to polio, you can ask them the same questions and use the map as well. Thanks for taking the time to watch this video. By understanding post-polio topics, you are helping to improve health outcomes. Visit Polio Australia's website for further information and to download resources.